Um, can you tell me about the diagnosis? Like how exactly is the diagnosis determined?
So first of all, you got to look at the symptoms, signs and symptoms of patient having coronary artery disease. So most of them present with chest pain, sometimes shortness of breath, as well as fatigue. So they come to you, they're having a lot of chest pain. What we normally do, we start the EKG right away, and then we doctors will order some labs like troponins and lipid panels and CMPs. By the time those results come over, they determine if the patient's having a cardiac related chest pain or having other problems.
You said EKG is a test to help diagnose CAD. Are there any
Yes.
other tests?
So, like I said, some lab tests we can do. If they have plenty of times, they can order some CT just to determine if there's any other problem and it's not heart related. Also, X-ray can rule out some pulmonary embolism or any other trauma or having that can cause chest pain.
Yeah, that was gonna be my next question. Are there any radiologic exams that are ordered for to help diagnose what is and isn't CAD? You
So
said chest
for
chest X-ray?
yeah, I yeah just rule out other pathologies or any other problem that's not related to the heart. They can also order some CT scan, like I said,
Mm-hmm.
coronary angiography. When they shoot some dyes and take a look at the coronaries, sometimes they ordered some. Um, they have this calcium scoring. They try to look some of the vessels of the heart. See if there's plenty of calcium buildup. That could probably will tell you if the patients have having going to have coronary artery disease later on. But those are the tests that's not immediate. Those are the tests that I can do as a outpatient. So we're primarily dealing with acute cases. So that's my that's where I work with. Well, so my doctors normally just have them take EKGs and troponins and see if their patients are really having a bad heart attack, and we don't delay. So we have them go to the cath lab right away to get that arteries unblocked. Sometimes we put a stent, sometimes they just unblocked it, and they give a lot of uh, antiplatelets, or we called um, blood thinners.
Okay.
So those patients have so they don't develop any blood clots.
Okay. Thank you. Uh, for possible treatments, how is CAD treated?
So for so like most of the time when we send home our patients, if they really have bad heart attack, they the doctors are started them on, like I said, blood thinners, sometimes Plavix. They give him some beta blockers to kind of slow down the heart, get that heart enough time to rest. And that way they don't go into heart attack again. Uh, Also,
And you said stent? What is stent?
stent is like a scaffolding that I put in during procedure that we called angioplasty. So they go into the heart. The access sometimes goes from the inguinal area, or what we call the femoral artery, femoral vein. Sometimes they access to the radial artery or radial vein that goes. So they access it. They use a very small wire, guide wires that goes to the coronary arteries. Pretty amazing, man. So and then they deploy this balloon, open up the heart. I mean the coronaries, the arteries, and then if they feel like it's not gonna be enough to open up, so they put us the what we call drug-eluting stent. So it's like a scaffolding. It's just trying to make sure that the vein is, I mean, the arteries are open, so those nutrients and oxygen can pass through that blockage and go to the important areas of the heart so they can continue functioning.
And that was angioplasty?
Yeah, it's a coronary angioplasty. They go to a procedure area.
That's the procedure. Okay. Um, are there any other therapies that
Oh
assist
yeah.
patients with
So
diagnosis?
yeah, so they normally we initiate them on a diet therapy. Also, we ask them not to eat or drink. I mean, eat fatty foods and then drink alcohol. We ask them to be have physical therapy or go to rehab, cardiac rehab specifically. You also give them, I mean, the doctors give them statins, as, cholesterol lowering drugs. What else? I think that's about it. And then, of course, they follow them up uh, closely.
Follow up
Follow
later
up
on.
closely. The cardiologist follow them up closely just to make sure that they are sticking with the regimen and they're not going to have a bad heart attack for later.
Mm-hmm. Regular checkups.
Yep.
Okay. Um, Generally, what's the chances of recovery or life expectancy after diagnosis, or yeah, after getting diagnosed with CAD?
So what we gather in the studies that says that it pretty much they can manage if they can manage the risk factors of coronary artery disease, you can live a long life. So as long as you get your cholesterol controlled, your glucose or your I mean your sugars controlled, you're not having diabetes and any of that. If you're going to have your blood pressure controlled, also lifestyle change, it's very important. You need to be really active and get that heart working. Those are the things that if you manage those risk factors, are you can live a long life. So that's why it's become a must to have all these patients take some beta blockers, lipids, I mean, cholesterol pills, and aspirin or antiplatelets, just to make sure that all the coronaries are working. So you don't develop a bad heart attack, which is it can lead into a lot of complication that includes heart failure or congestive heart failure.
Are there is there any factors that can influence a more positive prognosis? Like,
Um,
yeah.
I would say, based on my experience, is being healthy, trying to be healthy, and following your cardiac rehab protocol. I mean, being active and all that. That's one of the very positive things that you can do to alter this. Not alter, but just to maintain whatever you have. Make sure that your heart is healthy. So you need to get the heart working, like running a 5K or 3K or 10K. That's really get your heart working, man.
Yeah. Okay. Thank you. Is there anything else you want to add for CAD? coronary disease.
I think just based on my experience as working as a nurse. That I think that's the only thing I can say. So
Mhm. Okay. Thank you for your time, Tito Mike.
okay, thank
Thank
you,
you.
Lee. Have a good
Bye-bye.
day. Good night. Bye.
I'll talk to you soon. Bye-bye.
Okay. Bye.